The surprising effects on the prostate when older men relieve themselves daily. Your body doesn't stop needing care just because you've stopped talking about it. And your prostate? It's still listening, even if you've stopped paying attention. Let me ask you something real honest. Have you ever had that moment, maybe in the quiet of the morning or late at night, when your thoughts wandered to something private? Maybe you caught yourself thinking back to an old habit, a ritual, something natural, something most men do, but few talk about. And then you stopped yourself. You thought, I'm too old for that now. It's not important anymore. I should focus on more serious things. But what if I told you that this very habit, often ignored, misunderstood, or brushed aside, could actually be one of the best things you can do for your prostate health after age 60? Today, we're diving into a topic that doesn't get nearly enough attention. How daily ejaculation affects the prostate in older men, and why understanding it might be the key to staying healthy, independent, and strong well into your later years. This isn't about shame or secrecy. It's about biology. It's about health. It's about giving your body what it needs, even as it changes with time. Because here's the truth. Neglecting your prostate doesn't make it stronger. It makes it vulnerable. And one of the simplest, most overlooked ways to support your prostate, especially after 60, is by maintaining a consistent rhythm of release. Now, I know this might feel uncomfortable to hear, or even harder to talk about. But trust me, this conversation matters. So, whether you're in your 50s, 60s, or beyond, whether you're still sexually active or have stepped back from that part of life, whether you've wondered if it's still okay to do it, or if it even matters anymore, this episode is for you. Let's start with the basics. Brain, what is the prostate, and why does it matter? Deep inside the male pelvis, nestled just below the bladder and in front of the rectum, lies a small but powerful gland called the prostate. It's about the size of a walnut, but don't let its size fool you. This tiny organ plays a huge role in both sexual function and urinary health. Its main job? To produce prostatic fluid, which nourishes and protects sperm during ejaculation. But it also has another critical role, one most men don't think about until it starts causing problems. The prostate surrounds the urethra, the tube that carries urine out of the body. When the prostate swells, hardens, or becomes inflamed, it can press down on that tube, making urination difficult, slow, or even painful. And as men age, especially past 60, these issues become increasingly common. In fact, studies show that over 50% of men over 60 have some degree of benign prostatic hyperplasia, BPH, or prostate enlargement. By age 80, that number jumps to 90%. That's not just a statistic. That's a reality for millions of men. And while BPH isn't cancer, it can lead to complications like frequent nighttime urination, incomplete bladder emptying, urinary tract infections, even kidney damage in severe cases. So how do we keep the prostate healthy, especially as we age? One answer may surprise you. It's not surgery. It's not medication. It's not a special diet, though those help. It's something most men already know how to do. It's ejaculation. Yes, you heard that right. Sweat droplets ejaculation isn't just about pleasure, it's about health. Let's take a step back and look at the science. Ejaculation is more than just a reflex or a release of tension. It's a complex biological process involving the brain, the nervous system, the pelvic floor muscles, the prostate itself. And every time a man ejaculates, whether through sex or masturbation, a series of physical and hormonal responses take place. One of the most important effects? It helps clear out the prostate. Think of your prostate like a filter. Over time, dead cells, excess proteins, and biological waste build up inside it. Without regular release, this buildup can lead to inflammation, swelling, and eventually, enlargement. But when a man ejaculates regularly, especially with consistency, this waste gets flushed out. A study published in the Journal of Urology found that men who ejaculated more frequently were significantly less likely to develop prostate cancer later in life. Another study from Harvard T.H. Chan School of Public Health showed that men who ejaculated 21 times or more per month had a 33% lower risk of developing prostate cancer compared to those who ejaculated only 4 to 7 times a month. Now, does that mean everyone who masturbates lives longer or avoids disease? Of course not. But it does suggest that ejaculation plays a protective role in prostate health, and that ignoring it could come at a cost, especially as men age. Speech balloon. Meet James, the man who thought he was fine. James was 67 when he first came to see me. He lived in Arizona, worked part-time at a hardware store, and said he was in decent shape for his age. He didn't smoke. He didn't drink much. He walked every day and ate mostly home-cooked meals. His biggest complaint? Frequent nighttime urination. A feeling like his bladder wasn't fully emptying. Occasional discomfort in his lower abdomen. He'd been to his doctor, who ran some tests. His PSA levels were slightly elevated, nothing alarming yet, and his ultrasound showed mild prostate swelling. But there was no infection, no tumor, no red flags, just discomfort. When I asked him about his sexual habits, he hesitated. I haven't really done anything like that in years, he admitted. After my wife passed away, it just didn't seem important anymore. He shrugged. I figured I was past that stage of life. But when we dug deeper, I realized something. James hadn't had any kind of ejaculation, even alone, in over 5 years. He wasn't alone in that. Many men over 60 assume that sexual activity is no longer relevant once they're single, retired, or dealing with other health concerns. But the truth is, your prostate doesn't stop needing attention just because you've stopped paying attention to it. We made a plan together. Not drastic, not uncomfortable, just a gentle return to a consistent routine, 2 to 3 times a week. We also added light exercise, hydration, and prostate supportive supplements. 4 months later, James came back for a follow-up. His symptoms had improved dramatically. Nighttime urination dropped from 4 times a night to just once. The heaviness in his lower abdomen was gone. His PSA levels had stabilized. But the most surprising change? His mindset. He smiled when he told me. I didn't realize how much better I could feel just by doing something so simple. Magnifying glass tilted left. So what exactly happens to the prostate without ejaculation? Let's break it down. Not just what happens, but why it matters. 1. DHT buildup, the hormone that can cause trouble. Dihydrotestosterone, or DHT, is a powerful hormone derived from testosterone. It plays a key role in developing male characteristics, like facial hair, muscle mass, and deep voice. But here's the problem. High levels of DHT are linked to prostate enlargement. Every time a man ejaculates, DHT levels drop temporarily. This gives the prostate a short but important break from constant stimulation. But if ejaculation stops for long periods, weeks, months, even years, DHT continues to circulate unchecked. Over time, this can contribute to prostate swelling, tissue thickening, and increased pressure on the urethra. 2. Pelvic floor stiffness, the hidden side effect. The pelvic floor muscles are responsible for controlling urination and supporting sexual function. They contract during ejaculation, helping to push semen through the urethra. But without regular contractions, these muscles can stiffen and weaken. This leads to poor urinary control, weaker erections, increased risk of urinary retention. It's like not using a muscle group for months. It atrophies. And just like leg muscles need movement, so do the muscles around the prostate. Regular ejaculation keeps them engaged, toned, and responsive. 3. Immune activity disruption, when the body forgets how to cleanse. Your prostate has its own immune system, a local defense network designed to remove waste, fight off minor infections, and keep the gland healthy. One of the ways it does this? Through ejaculation. Each time a man ejaculates, the prostate flushes out cellular debris, excess proteins, and metabolic waste. If this process slows or stops, the immune system can become confused or overwhelmed. This can result in chronic low-level inflammation, a condition that's hard to detect but can cause persistent discomfort, frequent urges to urinate, and even pain in the pelvic region. These symptoms often show up in tests as non-bacterial prostatitis, a diagnosis that leaves many men frustrated and searching for answers. But the solution? Sometimes, it's simply restoring the prostate's natural rhythm. Light bulb, how often should you ejaculate after 60? Now, I know what you're thinking. How much is too much? Is it safe to do it every day? What if I don't feel like it? Let's address this honestly. There's no universal rule. Every man is different. But based on clinical experience and urology guidelines, here's a general recommendation by age group. 50 to 59, 2 to 3 times/week. Good balance between prostate health and recovery. 60 to 69, 1 to 2 times/week. Helps maintain circulation and cleansing. 70 plus. 1 time/week. Supports prostate without overexertion. Remember, this isn't about performance. It's about consistency. Even if you don't feel aroused every time, simply going through the motion, gently and naturally, can still offer benefits. The goal is to keep the prostate active, not stressed. And if you're concerned about fatigue, energy levels, or side effects, listen to your body. Some signs it might be too much. Feeling drained afterward. Lower back pain. Difficulty urinating. Persistent tiredness. If you notice any of these, scale back. Find your rhythm. Your body will tell you what it needs. Speech balloon, a personal question for you. Let me ask you something real. Have you noticed any changes in how your body feels lately? Maybe you wake up with a full bladder but struggle to empty it. Or maybe you feel a dull ache in your lower abdomen. Or perhaps you just feel off. If so, don't ignore it. Your prostate is trying to tell you something. And the good news? You don't have to suffer in silence. You don't have to accept discomfort as a normal part of aging. You just need to understand how your body works and give it what it needs. Which brings me to my next point. Men in lotus position beyond biology, the emotional side of letting go. Now, let's talk about the elephant in the room. For many men, especially those over 60, sexuality isn't just about biology. It's tied to identity, to confidence, to self-worth. And when men stop engaging in sexual activity, even alone, it can trigger a cascade of emotional effects. Here's what often happens. Men begin to feel invisible. They stop seeing themselves as desirable. They pull away from conversations about intimacy. They assume they're past that stage. But here's the truth. Sexuality doesn't disappear with age. It evolves. And one of the most powerful ways to stay connected with your body and your sense of self is by honoring that evolution. Masturbation isn't just about pleasure. It's about reconnecting with your body. It's about maintaining control over your health. It's about reminding yourself that you still matter. And for many men, that realization is life-changing. Pushpin final thoughts. Don't ignore what your body needs. So to recap, the prostate is a vital organ that supports both sexual and urinary health. Regular ejaculation helps cleanse the prostate, reduce DHT buildup, and support immune function. Going too long without release can lead to swelling, discomfort, and increased risk of prostate issues. Ejaculation frequency should be adjusted by age and individual response, but consistency matters. Emotionally, maintaining a connection with your body can improve confidence, mood, and overall well-being. You don't have to be young to be healthy. You just have to be intentional. And sometimes, the simplest habits, the ones we overlook, are the most powerful. So if you've been neglecting this part of your health, consider this your wake-up call. Your prostate is still working for you. It's time to work for it, too. After 75, 99% of deaths happen for these 5 reasons. How to avoid them and stay healthy. Episode 2. Falls and Injuries. The silent threat that robs lives in an instant. You don't fall because you're old. You grow old because you stop moving. Let me ask you something real honest. Have you ever had that moment, maybe walking across the kitchen floor or stepping off a curb, when your foot slipped just a little? Maybe you caught yourself before anything serious happened. Maybe you laughed it off. But if you're over 75 or getting close, I want you to pause and really listen today. Because we're talking about one of the most dangerous, yet often overlooked causes of death after age 75, falls and injuries. And here's what most people don't realize. Falls aren't just accidents. They're symptoms. Symptoms of a body that's been quietly weakening for months, sometimes years, without you even noticing. In fact, falls are the leading cause of injury-related deaths among older Americans. According to the Centers for Disease Control and Prevention, CDC, more than 36,000 adults aged 65 and older die each year from fall-related injuries, and the number only increases after 75. But here's the good news. Most falls are preventable, and once you understand how they happen and why they're so dangerous, you can take steps to protect yourself or someone you love. So whether you're in your 70s, 80s, or beyond, whether you live alone or with family, whether you've already had a fall or not, this episode could literally save your life. Let's get started. Broken heart. Meet Walter, the man who thought he was fine. Walter was 78 when he fell in his garage. He wasn't doing anything risky, just reaching for a box on a high shelf. His balance shifted. His feet didn't catch him in time. He hit the concrete floor hard, and within minutes, his daughter found him on the ground, unable to stand. At the hospital, doctors confirmed the worst, a fractured hip. It wasn't supposed to happen to him. He was active. He walked every day. He ate well. He took his medications. But what he didn't realize was that his body had been slowly losing strength for years, and he hadn't noticed until it was too late. That one fall changed everything. He spent 3 weeks in rehab, then months learning to walk again. And by the time he returned home, he was never quite the same. He stopped going out, stopped cooking, stopped calling friends. Within a year, he passed away, not from the fall itself, but from complications that followed. His story isn't rare. It's common, and it starts long before anyone hits the floor. Warning: why falls are so dangerous after 75. Let's talk science, not to scare you, but to empower you. As we age, our bodies change. Our muscles weaken. Our bones become more fragile. Our reflexes slow down. And when you combine those changes with other risk factors, like poor vision, medication side effects, or unsafe living conditions, the risk of falling increases dramatically. Here's what happens during a fall. Your brain sends a signal to your muscles to adjust your balance. But if your nerves are slower or your muscles are weaker, that signal doesn't reach fast enough. Gravity takes over. You fall, and once you hit the ground, the real danger begins. Common injuries from falls include hip fractures, head trauma, spinal injuries, soft tissue damage, internal bleeding. And for many seniors, especially those over 75, these injuries can lead to a rapid decline in health, sometimes ending in death. The CDC reports that over 95% of hip fractures are caused by falls, and nearly half of all seniors who suffer a hip fracture will need help walking within a year. Some never walk again. Some pass away within 6 months. And tragically, most of these outcomes could have been avoided. Brain: why most people don't take fall risks seriously. Let me ask you something real. When was the last time you thought about your balance? Or your muscle strength? Or the lighting in your hallway? Most people brush this off as unimportant, until they or someone they love has a fall. But here's the truth. Falling isn't random. It's predictable. And the signs are there long before the first stumble. Think back to the last time you felt a little wobbly getting up from a chair. Or the time you reached for something and almost lost your balance. Did you chalk it up to just getting old? Did you think it was no big deal? You weren't imagining it. Your body was giving you a warning. And if you ignore those warnings long enough, eventually, gravity wins. Microscope: what science tells us about falls in older adults. Let's look at some research to understand just how serious this issue is. White heavy checkmark study number 1. Muscle loss begins earlier than you think. A study published in the Journal of Gerontology found that muscle mass begins declining around age 50 and accelerates after 70. By 80, many adults have lost up to 30% of their original muscle mass, especially in the legs and core. That means less strength, less stability, higher fall risk. White heavy checkmark study number 2. Vision and balance decline together. Another study from Harvard Medical School showed that vision loss and balance issues go hand in hand. As eyesight worsens with age, due to cataracts, glaucoma, or macular degeneration, the brain receives less visual input, making it harder to judge distances and maintain posture. White heavy checkmark study number 3. Medications increase fall risk. According to the American Geriatric Society, more than 40% of falls in older adults are linked to medication use, particularly blood pressure medications, sedatives, antidepressants, sleeping pills. These drugs can cause dizziness, slowed reaction times, and confusion, increasing the chance of a fall. White heavy checkmark study number 4. Fear of falling causes more falls. Perhaps most interesting and most tragic is a phenomenon known as the cycle of fear. Many seniors, after experiencing one fall, begin avoiding movement altogether. They stop walking. They stop climbing stairs. They stop going outside. But here's the twist. Reduced activity leads to weaker muscles. Weaker muscles increase fall risk. And the cycle continues. One man I met, named George, described it perfectly. I stopped going out because I was scared of falling. But the more I stayed inside, the weaker I got. And the weaker I got, the more scared I became. He ended up falling twice in the next year, both times inside his own home. House with garden: real-life dangers in everyday spaces. Let's talk about where most falls actually happen. Contrary to what you might expect, most falls don't happen outside. They happen inside the home, in the very place you feel safest. Here are the top 5 places where seniors fall. Bathroom, slippery floors, lack of grab bars, difficulty getting in and out of the tub. Stairs, uneven steps, poor lighting, weak leg muscles. Kitchen, cluttered floors, reaching for high shelves, standing too long while cooking. Bedroom, getting out of bed at night without proper lighting or support. Living room, rugs that slip, furniture that's hard to rise from, or simply standing up too quickly. And here's something most people miss. Even small hazards can be deadly. A loose rug, a dim hallway, a wet tile floor. These aren't just minor inconveniences, they're tripwires waiting to trigger disaster. Woman in lotus position, meet Helen, the woman who took action before it was too late. Helen was 76 when she came to see her doctor for a routine checkup. She mentioned casually that she'd been feeling a little shaky lately. Her doctor asked her a few simple questions. Do you use a cane? Do you wear sturdy shoes? Is your house free of tripping hazards? Helen admitted she didn't use any assistive devices. She wore slippers most of the time. And yes, there were a few throw rugs in the hallway. Instead of sending her home with a warning, her doctor referred her to a physical therapist. Over the next 6 weeks, Helen did simple exercises to improve her balance. She learned how to safely move around the house. She installed grab bars in the bathroom and removed loose rugs. 6 months later, she told me, I used to think falling was just part of getting older. Now I know it's not. It's just part of not preparing for it. And guess what? She hasn't fallen since. Hammer and wrench practical steps to prevent falls, starting today. Now, let's talk about what you can do, starting right now, to reduce your fall risk. 1. Get a balance assessment. Talk to your doctor or physical therapist about doing a balance test. Many clinics offer free screenings for seniors. 2. Improve lighting in your home. Make sure every hallway, stairwell, and bathroom is well lit. Use motion sensor lights at night. 3. Remove trip hazards. Take out loose rugs. Keep cords out of the way. Store items where you don't have to stretch or climb. 4. Install grab bars and handrails, especially in the bathroom and on stairs. These small additions can make a huge difference. 5. Use assistive devices when needed. If you need a cane or walker, use it. These tools aren't signs of weakness. They're tools of independence. 6. Check your medications. Ask your pharmacist or doctor if any of your medications cause dizziness, fatigue, or imbalance. 7. Stay active. Even light exercise helps. Try walking, chair exercises, Tai Chi, stretching. Movement keeps your muscles strong and your reflexes sharp. 8. Review your vision regularly. Schedule regular eye exams. Make sure your glasses are up to date and your vision is clear. Speech balloon, a personal question for you. Let me ask you something real. Do you ever worry about falling, but pretend you're fine? Maybe you've already had a close call. Maybe you've noticed your balance isn't what it used to be. Maybe you avoid certain activities because you're afraid. If so, please don't ignore it. Your body is trying to tell you something. And the best time to act is before you hit the floor. Man in lotus position, fear isn't weakness, it's a signal. I want to say something important. Being afraid of falling doesn't mean you're weak. It means you're aware. It means you care. It means you're paying attention to your body. But fear shouldn't keep you from living. Instead, it should motivate you to prepare. Because the goal isn't to stop moving. It's to move more safely. And that starts with awareness. Pushpin final thoughts. So to recap, falls are one of the leading causes of death after 75. They often start with small signs, balance issues, weakness, instability, that are easy to ignore. Scientific studies show that muscle loss, vision decline, and medication side effects all contribute to fall risk. Real-life stories prove that taking action, even small steps, can prevent disaster. Simple changes like better lighting, removing rugs, using assistive devices, and staying active can significantly reduce fall risk. And above all, falling isn't fate. It's a risk you can manage. You don't have to accept weakness as normal aging. You don't have to give up your independence. You just have to understand the risks and take action. Because the truth is, you deserve to stay strong. You deserve to stay safe. You deserve to stay independent for as long as possible. And it starts with listening to your body. Not when it screams, but when it whispers.